Howdy, it's Dr. Tamara Hunter here, coming to you on Thursday afternoon. Now it is 3 o'clock and I did say I was going to come on here at 12. Massive apologies. The day kind of got away from me. I knew at the beginning of the week I should never have put set times in here, but here we are, and I promise to the best of my ability I will be on tomorrow as scheduled. But I'm here. It's 3 o'clock Thursday afternoon, and I wanted to talk to you briefly around the impact of food choices, nutrition, on pregnancy and getting pregnant and having a healthy pregnancy. So the first thing I want to say is that you should always consult, if you're having issues around food, you should always consult with a healthcare professional to do a proper analysis that's appropriate to you. But I'm just going to give you some kind of broad overall principles. So back in 1976, they started the Nurses' Health Study that looked at the health of nurses, over 120,000 nurses throughout their life. And one of the areas that they looked at was the impact of food choices, of weight, and also of nutrition on pregnancy. So there's two areas, I suppose, here. There is the ability to get pregnant. I suppose in a way that's our fertility, isn't it? And there's also pregnancy outcomes, so the health of the mum and the health of the baby in the pregnancy itself. So one of the things they looked at was the most fertile bunch of women versus the least fertile bunch of women, and they did dietary analysis. And they found that the more fertile bunch of women tended to have a diet that was rich in fruits and vegetables, lean cuts of meat. Dairy was in there as well, because we do know that dairy sources are a great range of vitamins and minerals. Of course, a lot of people tend to move away from dairy now, but there is the importance of calcium and magnesium in there. So as long as you're getting calcium and magnesium from somewhere else, but I'll come to that a little bit later. What else? They also had fruits and veggies, lean cuts of meat, dairy, and omega fats. So omega fats coming from either fish sources or nuts, seeds, and legumes. So it was interesting that kind of diet is very much what we see in a Mediterranean diet. And we know that a Mediterranean diet is kind of the diet of choice for most health conditions, including cardiovascular disease. So the information sharing there is not too different. The other thing that they found in the Women's Health Study was the importance of folic acid. And so I want to talk particularly to that, because we do know that there are some things that are vitally important in pregnancy. And folic acid is one of those nutrients that's really important in pregnancy, particularly in the early stages of pregnancy when the neural tube is forming. In fact, by the time a woman gets her positive pregnancy test, the neural tube is already formed. So it's what you're doing in that month prior with regards to folic acid that is vitally important. So many times I sit with couples, and one of the questions I ask is, are you trying to conceive? Are you on folic acid? Oh no, I kind of got bored. Totally understand that, taking that for a year every day, day in, day out, but vitally important not to miss it, because by the time you know you're pregnant, you needed it in place beforehand. Now, folic acid we know is really important for DNA synthesis and cell growth. And this is a really, really metabolic time. So having, and DNA, like we're making a human. So folic acid is vitally important in the form of supplementation. Yes, you can get a lot of folate in your diet, your green leafy vegetables. There we are, fruits and veggies at the top of the list again. However, and a lot of our foods are fortified now, so breads and cereals are fortified with folic acid. But the recommendation, the evidence shows that we need to be getting 400 to 500 micrograms in addition to whatever we are having in our diet. So make sure that you are on an appropriate pre-pregnancy supplement. Now, as far as other nutrients that are important, vitamin B12, all the B group vitamins are really important. I find a lot of women get good relief of their hyperemesis, morning sickness, if they are taking a vitamin B6. So a B complex is really good, again, in the green leafy vegetables. Vitamin B12 is important. So again, if you're vegan or vegetarian, you've got to be really careful that you actually have adequate amounts of vitamin B12 getting into your system. Another really important vitamin is vitamin D. Now, vitamin D is made in the skin on exposure to the sun, about 20 minutes per day. Of course, most of us slip, slop, slap now, so a fair amount of women are vitamin D deficient. Now, coming out of summer, we're not doing too badly at the moment, but once we head into winter, a fair number of women will be vitamin D deficient going into pregnancy. And there is emerging evidence, emerging research to suggest that there is some relation of subfertility to vitamin D deficiency. So again, get that checked, and if you are vitamin D deficient, either get some sunlight every day or be taking a vitamin D supplement. Now, as far as minerals that are really important in pregnancy, none of these are an absolute lay down misere. The only nutrient you must be supplementing leading into pregnancy is folic acid. We've just talked about that. All of the others, I would just encourage you to get in your whole foods, or if you have been deemed deficient, then be supplementing. So the number one on the list is iron, and everyone should be having their iron checked by their GP in their antenatal bloods. If not, you might need to supplement. Now, the problem with iron supplementation is sometimes it can cause a bit of gut upset, so it's really important to find one that is suitable for you. It's also important to be combining it with vitamin C. There's that important vitamin. So again, making sure that if you're having your steak a couple of times a week, that you're having some oranges in there or some vegetables that contain vitamin C that are going to help with the uptake of iron. So, and iron, Ferrograd C is one that's combining iron and vitamin C. But, you know, if you can get it out of your diet, fabulous. As far as the other nutrients, iodine, really important. In metropolitan Perth, we're not doing too badly with our iodine, but there are some communities around Australia that are very iodine deficient, and this can cause pregnancy problems and problems with the baby. So having iodine in your diet is important. Where do you get it from? Well, again, generally in a supplement. Iodized salt, though I wouldn't be recommending that you increase your salt intake too much. You'd have to have at least probably between a teaspoon and a tablespoon of iodized salt to be getting enough iodine in your diet every day. And then the last nutrient that I feel is really important, and again, there's emerging evidence around this, is the importance of omega-3 fatty acids. We know omega-3s are really important for the development of the nervous system. I know for sure that in preterm neonatal units, they do treat babies with omega-3s because it's so important for their eye and their nervous system development. So, and there is some emerging evidence around deficiency in omega-3s and the impact that has on infertility. So, nuts, seeds, you know, if you have to go for a fish source, just be careful. The open sea fish increase risk of heavy metals, mercury particularly. So looking perhaps for a supplement that might come from plant-based as opposed to fish-based. But certainly omega-3s are also really important. So that's kind of sort of deep diving into the nutritional stuff. What I will say is this, that two of the most important aspects of nutrition and pregnancy is weight. Hugely important. And I've spoken about this previously, the impact of weight on infertility. But we know that if a woman loses at least 10% of her body weight, if she's overweight or obese, she's going to double her chances of falling pregnant, halve her miscarriage rates, but also significantly reduce the chances of developing gestational diabetes later in life. So weight management matters. It matters to pregnancy outcomes. We know that overweight women are more likely to have cesarean deliveries. They're more likely to have instrumental deliveries. They're more likely to end up with a baby that requires a nursery admission. So it is important to watch your weight in pregnancy, but also ideally enter pregnancy at an optimal body mass index. The last thing I really want to touch on is what not to eat. What not to eat in pregnancy. So there is not a really long list. The one thing that people worry a lot about is soft cheeses, sushi, anything eaten out of a bain-marie. Definitely food has been sitting around for a long period of time. And the issue with sushi is just when was it made? If it's fresh made, fine, not a problem. But if you are eating sort of raw fish, if you're eating bain-marie rice that's been sitting there for hours in a nice sort of warm environment for bacteria to grow, if you're having soft cheeses that are made from overseas, generally the pasteurisation and homogenisation of cheeses here in Australia is pretty good. So the chance of you getting listeria is exceptionally rare. But, imported cheeses, bain-marie food, and sushi that might have been made days ago probably would suggest you stay away from. But the rates of listeria infection in Australia are exceptionally low, and they tend not to be in urban areas. They tend to be in regional and remote communities. So that's the first thing I want to say. So don't panic too much about the sushi. The next thing to think about is alcohol. There is no lower limit of safety of alcohol consumption in pregnancy, period, at any time. So let's just put that one to bed. No alcohol in pregnancy. The third one I want to talk about is caffeine. A lot of people worry about how much coffee they drink. Personally, I couldn't stomach coffee after about 6 weeks, but there's no real relationship with harm on pregnancy and caffeine intake. There is some evidence around having more than sort of 3 to 4 shots of espresso coffee on the rates of miscarriage and chances of falling pregnant. But again, there are other confounders in those studies. For example, people who drink a lot of coffee tend to smoke. And we know smoking's not good for pregnancies. So the study quality is not very good, but I would say just pull back 1 a day. That's all you need. And then the last thing, probably stay away from raw eggs. The risks of salmonella with raw eggs are still present. So I wouldn't be downing the protein smoothie with a cracked raw egg in it. There's plenty of other ways to get protein into your diet. So guys, hopefully that was really helpful. If you know of someone who's trying to conceive or someone who is pregnant and wants a little bit of information around food, nutrition and pregnancy, please pass this on to them. I will be coming to you tomorrow. One of my favorite topics is something called secondary amenorrhea, or why has my period stopped all of a sudden. So join me tomorrow. It's a huge topic. I might just talk to one small area that I see a lot of. But yeah, if you want to jump on tomorrow, it'll be around 1 o'clock. I'm not going to promise exactly, but it'll be around 1 o'clock. I look forward to seeing you then. Have a great rest of your day.